I'm going to start off with a very important message for all of you who are not vaccinated yet. I urge you to vaccinate. As we know, the pandemic has had a catastrophic impact on our country, on our healthcare infrastructure, and also a grave impact on the economy. The only way that we will be able to mitigate the spread of infections, also preclude the possibility of a third wave, is only with vaccination. So the government as well as the healthcare bodies have been quite explicit about the importance of the vaccination. Now it's up to us, the community, to step in and make this vaccination drive a successful one to overcome and win against this pandemic. We've known, like Professor Ramchandran said, there's been a lot of myths and a lot of fears that have been circulating on social media as well as from hearsay information. Some of the concerns that patients have is if they are on antiplatelets, anticoagulants, should they stop before vaccination? This is some information, this is some questions that we've been constantly faced with. And the other concern is that whether you need to investigate for CRP or do other blood work prior to vaccination. Please understand, there is no requirement of stopping any medicine that the patient is on, who he or she is taking for any comorbidity, and there is no recommended blood workup prior to vaccination. So you can safely go and get vaccinated. Being a diabetologist, one of the commonest things that I face even today, I had a middle-aged woman who came and said, "Doctor, I'm a diabetic. Can I vaccinate?" And again, please do understand, patients, people with diabetes, hypertension, or other comorbidities are the high-risk group who should get vaccinated at the earliest. So with this message, let me move on. So we are at the crossroads of two pandemics. We have diabetes on one side and we have COVID on the other. And India seems to be having the dubious distinction of not just the diabetes capital of the world, but also seems to be propelling the current COVID pandemic. We've seen staggering numbers in the recent past and also some emerging new strains that have been quite concerning. So diabetes, as we all know, is a non-contagious, very passive chronic disorder, and COVID on the other side is a highly contagious acute illness and something which is gripped us all, and which grappled us all with fear. So we press the panic button once we hear COVID. Do we give the same kind of attention to diabetes? No. We take it far more lightly, far more easily. But should diabetes be approached that lightly? Definitely not. We know, as Dr. Nandita also elaborated, there is a bidirectional relationship even with COVID. Patients with uncontrolled blood sugars have not only a higher risk of contracting infection, they also have a higher chance of developing more serious infections and complications. That makes obvious reasons that we need to keep the blood sugars under control. And as again Nandita pointed out, COVID itself can precipitate new onset diabetes and worsen pre-existing diabetes. Now, this is not very exclusive to COVID alone. Uncontrolled blood sugars can increase the risk of contracting many other infections such as pneumonia, urinary tract infections, foot infections, so on and so forth. So it is imperative to keep the blood sugar under control to prevent infections and also to prevent long-term complications. Unfortunately, we've been seeing that the behavior of patients, since it's a chronic care disorder, they tend to postpone, they tend to avoid seeking help. And there is a different kind of patients. Since we have large number of patients, there are different behaviors. And the pandemic has only made things worse because now the patients are not neglecting care, they are not seeking support for their chronic conditions, which is actually making things worse. Let me draw some comparisons again with the COVID as well as diabetes. As you can see from this illustration, patients who are asymptomatic COVID disease, they are actually not a threat for themselves, but they could be actually infecting other people around them who could start developing probably an illness which could be symptomatic to even a severe illness. So that's why it's such a concern, and that's why lockdowns seem to help, because however good your screening protocols are, be it in the malls, airport, etc. It's still not foolproof. Patients who could be having mild symptoms, patients who could be asymptomatic, could be easily missed, and they are actually potential threats for other people who they could easily infect. On the other hand, asymptomatic diabetic patients seem to have different ramifications. Now, asymptomatic diabetic patient can be completely without any illness in the journey of diabetes. But after many years, the asymptomatic patient could actually harm him or herself. He has the risk of developing cardiovascular complications. He has the risk of developing renal complications, so on and so forth. So that's why it is extremely pertinent to keep the blood sugars under continuous control in order to prevent such complications. So it's easier said than done. So the uncontrolled blood sugar is actually the real elephant in the room. So that's where our attention should be. As we know, many of the guidelines have recommended, have proclaimed that you need to check your blood sugar every 3 months. And it is a huge challenge. Think about a patient who's diagnosed at 35 to 40 years. Today, we are getting patients who are diagnosed much earlier. The mean onset of age is much earlier in India, even compared to the Caucasian population. So if they have to continue to screen blood sugars at every 3 months, it is a huge challenge. So that's probably some of the concerns that we've been seeing with our patient over the years. And we felt that there should be a change in the way that we may be able to connect to patients and vice versa. So this is one of the challenges that patients face every day, every other time. We know that they have to depend on their family member, the near and dear. They have to depend on a relative or a friend to take them to a hospital. They have to organize for travel, and then they have to sit in a healthcare environment for hours together, not only for their blood investigations, also meeting the doctor. So these are challenges that the patients are burdened with at every interval. So this has to be largely overcome in order to establish continuous blood sugar control for patients and finally prevent them from complications. So on that note, as digital healthcare could possibly revolutionize chronic care conditions such as diabetes, hypertension, and dyslipidemia. We've seen that there has been an explosion of digital healthcare in the recent past, particularly during the time of the pandemic, from the time that the first wave has begun. But to understand where the digital healthcare can really play a major role would be actually in medical diseases such as diabetes, such as dyslipidemia and hypertension. I think this will be a game changer, and patients can now connect with their doctors through digital mediums and make sure their disorder is taken care of. On that note, we wanted to bring this digital solution for our patients at the same time without compromising the comprehensive diabetes care that we've been providing over the years. And that's how we launched Diahome. The advantage of Diahome is it gives you 360-degree comprehensive diabetes care. We made sure there is no compromise, and patients can now, at a touch of a button, connect with the doctor. There is no waiting time, and each patient has the advantage, can access the laboratory, can access the pharmacy. Everything is delivered at the patient's home step. And most importantly, which is exclusive to Diahome, is that we built a very unique investigation team with different skill sets, where not only the basic blood workup, but patient's height, patient's weight, patient's waist circumference, as well as blood pressure, if required, ECG, nerve conduction studies, Doppler biothermometry, and all of this can be done at a patient's home itself without the need to travel, without the need of waiting in queue for each of these tests at the hospital. So that's the advantage that Diahome brings into patient's life. And it has a complete holistic integrated care. Now, diabetologists work in tandem with the nutritionist as well as the diabetes educator. They all work in synchrony. And the advantage of a Diahome is we offer completely free of cost nutrition and diabetes education advice throughout. We also have free healthcare assistance support, which is offered completely free of cost for the patients. And then patients also have the advantage of access to electronic medical records. And as I mentioned, also can get the drugs delivered home. So all of this at a touch of a button. Diahome is the diabetes care partner for every diabetic patient.